abusing prescription medication is probably as prevalent as abusing street drugs.
More people die in Wisconsin each year from prescription drug overdoses than from car crashes. The number of people accidentally killed by prescription drugs nearly quadrupled nationally in the last 15 years. Good evening, I'm Eric Franke. First tonight, Wisconsin is now poised to take its most comprehensive action ever to deal with the problem. News 3 investigative reporter Adam Schrager joins us. And Adam, the goal is to track the dispensing of drugs. We're talking about OxyContin, Vicodin, drugs like that, right?
Yeah, Eric, in the medical world, they're called opioids or narcotics, but to us, they're pain pills, and when used appropriately, they treat things like broken bones. But more often these days, they're being abused. So the new Wisconsin prescription drug monitoring program is designed to save lives.
You can get it from your parents' medicine cabinet, your grandparents' medicine cabinet.
Jordan Shara's heard the whispers around Reedsburg High School.
It's not that difficult to get your hands on. It's sad.
So she acted to get her neighbors' unneeded prescription drugs out of their homes and into the police department.
I don't think people understand how dangerous these things can be. You can die from prescription drug abuse very easily.
Every 2 weeks, officers unload up to 150 pounds of pills.
This is life and death, but this is also hope.
Everything from benign medicine like ibuprofen to heavy-duty narcotics like oxycodone.
It's almost like they're just sitting on a gold mine in some people's eyes.
There are more than 1,200 gold mines in Wisconsin. A new state database is designed to let those pharmacies now talk to each other to protect Wisconsin residents from themselves.
This will really dramatically improve our ability to provide safe care for the patients.
Dr. Tom Meyer is an emergency room specialist at the UW hospital.
You can see the fracture.
Who a few years ago spotted an escalating problem.
It would say, oh, I lost my prescription, the dog ate them, or it went down the toilet.
Numerous patients were coming to the ER for narcotic refills. So he enlisted his colleagues and the ER docs at St. Mary's and Meriter hospitals to agree upon a plan.
While we would continue to provide prescriptions for acute pain, we wouldn't refill chronic medications, especially high-risk medications like methadone, Suboxone, oxycodone, OxyContin.
Patients would be steered toward their primary care physician for that. Dr. Meyer says giving Wisconsin doctors and pharmacists more knowledge will save lives.
Now a patient comes in with a pain issue, I look up in the registry, Wisconsin registry, find they've gotten 5 or 6 prescriptions already. I would say, you know, you really should be using those before you get some.
Hopefully we can do something about this prescription medication abuse that's occurring.
Back in Reedsburg, Police Chief Tim Becker and Jordan Shara are happy for any help to remove pills from the public.
We were at a situation where we needed a solution, and Jordan was able to help us come up with that solution.
The drug registry will mean fewer pills on the streets and more demand for those that are.
It really makes me want to just reach out to people and say, don't let this pile up.
A life and death battle being waged by the state and an individual, one prescription at a time. Right now, doctors and pharmacists around the state are putting these narcotics prescriptions into the computer database, and they're going to start sharing that information with each other on June 1st. That is when Wisconsin becomes the 45th state in the country to enact a prescription drug monitoring program.
Well, 45th state, got to ask, what took so long to implement what seems like is such an important policy?
It's a good question. It's actually the question, but it seems that the problem came here a little bit later than it did elsewhere in the country. While a lot of states were doing drug monitoring programs, Wisconsin was addressing pseudoephedrine issues, and when the database finally came before lawmakers 3 years ago, Eric, it passed overwhelmingly.
When it goes online, so it's kind of hard to predict what's going to happen. The folks you talk to, what do they say they'll expect that'll happen when it does go online?
Everybody is excited that it's going to go online, but there is some concern as well, which we're going to talk about tomorrow on News 3 at 6, specifically about if one avenue for an addict to get drugs is closed down, well, where do those folks turn? We're also going to have our complete interview with UW Dr. Tom Meyer right now on our website, channel3000.com.
I look forward to hearing more on this. Adam, thank you very much.
Thank you.